Hello, family. Happy Friday. Happy Friday. Today is another great day the Lord God has made. How are you all doing? How was the night? I hope you guys are fine. You guys are doing well as you can see. Let's go quickly to the point. There's something I want to remind us. It's not that it's something new or something we don't know. It is something I just want to let us know. Something I want to remind women. Not only women, even men. Because it's becoming the order of the day. It's like that is almost everybody that is experiencing such thing. So I want to remind you, I want to let you know few signs you see in your body that you are not supposed to neglect. Whether you are a woman, whether you are a man, whether you are married, whether you are not married, you are not supposed to neglect them. So let me go straight to the point. I'll start with women. If you're a wife, I keep on telling you, if you're a woman, whether you are married or not married, when you experience these things I'm going to mention, please don't joke with them. What is the first one? If you are not on your menstrual cycle and blood is coming out in your private part, there's stain of blood, maybe when you urinate you see blood, it is not a good sign. We know that every month women they do their distant blood supposed to come, but when you are not on your menstrual cycle and then you are experiencing this kind of thing, don't neglect it. Another one, when you are doing what men and women are doing in the bedroom, that is love making, and you are experiencing pains when you are making love, or when your husband is making love to you, or when your spouse or your partner is making love to you, don't neglect. You are feeling severe pain, is painful, don't neglect it. It might not be a good sign. Have to go for medical check. Go and see your consultant. Go and see your medical practitioner. Okay. And then if you are having maybe persistent cough, and that cough is not, you've taking some medications, some antibiotics, we believe in all this medication you try, it's not stopping, and it consists a cough all the time, go. It might not be good. It could be signs and symptoms of, if it is not TB, it could be lung cancer. And I keep on telling you, if you are not a breastfeeding mother and breast milk is coming out in your this tissue here, and instead of the nipple pointing out and it's pointing towards the inside, and you see something like pimple around that place, the nipple are going inside, don't neglect it. And I've said it, you've done your prolactin and it's normal, and yet breast milk is coming out, don't neglect it. Then check, each time you finish your menses, lie down like this on your bed. Use, this is my right hand, use it to palpate. We call it palpation. Do this way, palpate it very well. What are you looking for? You are looking for lump. If there's any lump that is, and that one is not painless, is painless, apart from the one that God puts here, there's another. If there's anyone, either even up to your armpit, you palpate. If there's anything like lump, you see what I'm doing like this, you have to do it. You have to lie down, then use this other one and palpate it the same, and draw it. If the nipple is going inside instead of going out, and you observe any lump, my darling, don't neglect it. Okay. Check any part of your body. If there's any lump at all that is painless, they call it painless. Any part of your body, whether you're a man or woman, even near man's organ, and there's any lump apart from the normal testes, don't neglect it. Even here, there's swelling here, because even TB, at times it doesn't show symptom. There's something we call asymptomatic. That one doesn't show symptom. That one is asymptomatic. All of a sudden, just you start experiencing it. So we call it. We have two type of tuberculosis. I'll make a video on that one. That one we have pulmonary and extrapulmonary. So that is where you look for lump. Okay, so please don't neglect it. So this is the thing that we need to do to keep our, this life is very, very sweet. So, but we have to do certain things in order to check our body. We don't take it important. Some people neglect it. You may think it will come and go. Even some pain, some severe pain you are passing through, whether chest pain, waist pain, back pain, and it is consistent and it doesn't want to go. Don't neglect it. Go and see your consultant. Go and see a physician. It is very important. Even any lump around this place, if you see lump, let us not neglect it. We need to do something about it. Even here, near your pubic here. And in that one, if you are a woman, you are having discharge. We have normal discharge, but there's abnormal discharge. If you are having abnormal discharge, it is very, very offensive. It's very, very offensive. Don't neglect it. You know what I mean? Don't neglect it. Go and see your consultant. Go and see a physician. Go and do something about it. And again, as a woman, when you're washing that side, you experience something like tissue paper coming out. Something like tissue paper. You don't have to neglect it. You don't have to neglect it. You have to do something about it. Okay? Any part of your body you're experiencing abnormalities, let us not neglect it. Because when you neglect it, by the time you may know, it may be too late. It may be too late because this thing we call this cancer is spread like wildfire, and it comes with different signs. It doesn't just come like that. The person may be having the signs inside which you don't know. That is what we always talk about. That's why we always tell people, go and check your body. Go and do body check. It is very important. You see this place, you see this place, you see this place, you always check. Whether you're a man or a woman, even a man, check, do your PSA. If you're a man and you're up to 45 years and above, do PSA. And if you're a man, any of maybe your father, your grandfather, great-grandfather had this, what they call prostate cancer, please go and check yourself. Don't neglect it. Because it's negligence that causes, I would have, I fall at that time. Don't neglect. So I said, let me come and talk to us before I leave. We will be bringing us more information that have to do with our health. Because health is wealth. Health is wealth. So that is why we have to take proper good care of our self. Check. Be conscious of what is happening within you. It's not everything is that they don't pursue you. Okay? There are some things that you notice. You know that, I'm having body changes. If you are also losing weight, and that weight is very obvious, go for medical checkup. Now so I got end them now. I say, make I come tell you now, make I bring this information, come give us. I love all of you. Bye bye.